The hypothesis that fruit peel bioactives, particularly flavonoids, polyphenol, and fiber, can play a pivotal role in regulating blood glucose, cholesterol, and blood pressure is deeply rooted in both mechanistic biochemistry and emerging experimental data, offering an exciting avenue for dietary strategies to prevent or manage diabetes and cardiovascular disease. Unlike the relatively nutrient-sparse pulp of many fruits, peels are nature's protective layer, concentrating potent compounds designed to ward off environmental stressors, compounds that, when consumed, can similarly shield human health from the metabolic insults of modern diets. One of the most compelling cases is the apple peel, which harbors high levels of quercetin, floridzin, and other polyphenol almost absent in the flesh. Quercetin, in particular, has demonstrated significant effects on insulin sensitivity, with preclinical models showing that it can enhance glucose uptake in skeletal muscle and adipose tissue by modulating key insulin signaling pathways. Human observational studies have also correlated high quercetin intake with reduced risk of type 2 diabetes, suggesting that the frequent consumption of apple peel-containing foods could offer meaningful glycemic protection. Banana peels provide a unique arsenal of tannins and other polyphenol capable of inhibiting carbohydrate-digesting enzymes, such as amylase and aglycosidase. This slows the postprandial release of glucose into the bloodstream, resulting in a lower glycemic index for meals containing peel-derived fibers or extracts. Such effects mirror those of pharmaceutical aglycosidase inhibitors used in diabetes management, but without the side effects often associated with synthetic drugs. Citrus peels also stand out for their rich flavonoid profile, particularly hesperidin and naringin, which have been shown to lower serum cholesterol by modulating hepatic lipid metabolism and increasing the excretion of bile acids. Animal studies indicate hesperidin supplementation can reduce LDL cholesterol levels and attenuate atherosclerotic plaque formation, while human intervention trials link citrus flavonoid intake with improved lipid profiles and reduced blood pressure, key factors in cardiovascular disease risk reduction. Fiber in peels provides another critical mechanism for both glycemic and cardiovascular benefits. Soluble fibers like pectin, abundant in apple and citrus peels, form viscous gels in the digestive tract that slow gastric emptying, blunt glucose spikes, and bind dietary cholesterol, reducing its absorption. Insoluble fibers, meanwhile, add bulk and modulate gut microbiota, which in turn produce short-chain fatty acids that improve insulin sensitivity and exert systemic anti-inflammatory effects, both crucial for managing metabolic syndrome. To rigorously test the hypothesis, experimental diets could compare outcomes in diabetic animal models or controlled human trials consuming either peeled or unpeeled versions of common fruits such as apples, grapes, and bananas. Key metabolic endpoints, including fasting glucose, insulin sensitivity, HOMA-IR, postprandial glucose excursions, lipid profiles, LDL, HDL, triglycerides, markers of LDL oxidation, and systolic/diastolic blood pressure, would offer a comprehensive picture of how peel bioactives impact metabolic health. Preliminary studies already hint at these benefits. For instance, apple peel polyphenol have been shown to inhibit LDL oxidation in vitro and reduce circulating oxidized LDL in animal models, suggesting a direct protective effect against atherosclerosis. Banana peel tannins have demonstrated delayed carbohydrate digestion, and clinical research on citrus flavonoids consistently shows reductions in blood pressure, an outcome strongly linked to cardiovascular mortality. Combined, these findings point to a powerful synergy between fiber and polyphenol in peels, uniquely suited to improve both glycemic and cardiovascular outcomes. Moreover, the potential for peel bioactives extends beyond individual health benefits to population-level public health. Encouraging whole fruit consumption or developing functional foods fortified with peel powders could help mitigate the rise of diabetes and cardiovascular diseases globally, especially in regions where access to medications is limited but fruit waste is abundant. Incorporating peels also reduces food waste, aligning metabolic health strategies with environmental sustainability. Investigating bioavailability will be key to translating these benefits. Polyphenol and fibers in peels may require processing methods, e.g., drying, grinding, or mild fermentation, to enhance their digestibility and absorption while maintaining or improving their bioactivity. Ensuring palatability is equally critical, as bitter or astringent compounds can deter consistent consumption if not properly balanced in food formulations. In sum, The evidence strongly supports the hypothesis that bioactives concentrated in fruit peels, including flavonoids, polyphenol, and fiber, offer significant potential for improving blood glucose control, lowering cholesterol, and reducing blood pressure. By merging nutritional epidemiology, controlled dietary interventions, and biochemical analyses, this research direction could revolutionize dietary recommendations, foster innovative functional foods, and harness the often overlooked power of fruit peels to fight two of the world's most pervasive chronic diseases.